We would now like to outline the medical and surgical risks of kidney donation. We have included the most serious risks and the most common symptoms, but this is not a complete list of all potential complications. The first one on the list is the most serious, but also the rarest. The mortality rate for kidney donors is 0.03%, or 3 out of every 10,000 donors. The donor will have scars after surgery. There is also a risk that the donor could develop a hernia, which is when the weakened abdominal muscles allow a pocket of fat or intestine to pop through. We ask donors to limit lifting and twisting for a period of time after surgery to allow the abdominal muscles to heal and minimize the chance of developing a hernia. There is also a risk of developing an infection at the incision site. The donor is asked to use an antibacterial soap for a few days before surgery and to avoid bathing or swimming for a period of time after surgery to minimize the chance of wound infection. The donor will have a decrease in overall kidney function, which we will discuss in more detail on the next slide. The next two abdominal or bowel symptoms are more commonly experienced by donors. During the donation surgery, some gas is pumped into the donor's abdomen to move the bowels out of the way and help with visualization and removal of the kidney. Most of the gas escapes after the surgery is complete, but a small amount remaining can cause bloating afterwards. Nausea is another common symptom, which can be caused by the anesthesia or pain medicines. Both of these symptoms are often alleviated by walking after surgery, so it is important to follow the recommendations of the transplant team. In extreme cases, these symptoms could lead to bowel obstruction, which may require additional treatment, including surgery. The donor may experience acute kidney injury and require dialysis or a transplant themselves, but this is incredibly rare. Age, obesity, hypertension, or other donor-specific conditions can increase the risk of morbidity or mortality, but if the donor team feels that a candidate is at particularly high risk, the candidate would be ruled out for donation. Even though kidney donors are donating about half of their overall kidney tissue, on average donors experience a permanent loss of 25 to 35% of their total kidney function after donation. The remaining kidney will increase its filtering to make up for being the only kidney. Although donors are not automatically at a higher risk of developing kidney disease when compared to the general population, they are at a slightly increased risk of kidney disease when compared to patients who were determined to be healthy enough to donate, but who did not actually go on to donate a kidney. We still feel that the risk is low enough that kidney donation is safe. Chronic kidney disease usually develops in one's 40s or 50s and progresses to end-stage renal disease in one's 60s, so especially for our younger donors, we cannot be 100% certain that the donor won't naturally progress to end-stage renal disease in the future. Living donors are at higher risk of developing kidney failure if there is trauma or damage to the remaining kidney, as they no longer have a backup kidney. The progression from CKD to ESRD may also be faster, and once the donor is in end-stage renal disease, they will need dialysis or a transplant. If the donor requires a transplant at any time after donation, they are given priority on the wait list according to current UNOS policy. There are some additional considerations for women who plan to have children after donating a kidney. There is an increased risk of developing preeclampsia or gestational hypertension, both conditions involving high blood pressure during pregnancy that can negatively affect the mother and fetus if untreated. However, a 2015 study found that there was no increase in preterm birth or low birth weight in previous kidney donors. There were also no maternal deaths, no stillbirths, and no neonatal deaths among the donors, so the study concluded that most women had uncomplicated pregnancies after donation. If a pregnant donor has specific concerns, we recommend they consult with a high-risk obstetrician for closer observation. The health information obtained during the living donor evaluation is kept confidential just like your other medical records, other than any reportable infections. Also, there are additional considerations for any infectious disease, such as HIV or hepatitis, or malignancy, or cancer, found in the donor during the first 2 years after donation that pertains to the care of the recipient. The donor would be informed of the results. If the result indicated the donor has a reportable infection, Mass General would be mandated to report the positive results to public health authorities. The recipient transplant center would also be made aware. If the donor is donating directly to their intended recipient, the post-transplant team would be informed. If the donor donated through the paired exchange, the transplant center that received the kidney would be informed. The transplant recipient may also be told about the results, especially if the recipient requires treatment or additional surveillance. UNOS also needs to be informed about any post-donation infectious disease or malignancy.
Hi, I'm Karen Tanklo, and I am the Living Donor Social Worker and the Living Donor Advocate. I'm about to tell you about the potential donor psychosocial risks. The following psychosocial risks are associated with living kidney donation, which may be transient or permanent and include but are not limited to the following: problems with body image, depression or anxiety after surgery, feelings of guilt, feelings of emotional distress or grief if the transplant recipient experiences loss of the kidney transplant, recurrent disease in the transplant, or if the transplant recipient dies, changes to the living donor's lifestyle from donation. And these are the potential financial risks associated with living donation. The following financial risks are associated with living kidney donation, which may be transient or permanent and include but are not limited to the following: personal expenses of travel, housing, child care costs, and lost wages related to donation might not be reimbursed, but please be advised resources may be available to defray some donation-related costs. Need for lifelong follow-up at the living donor's expense, loss of employment or income, negative impact on the ability to obtain future employment, negative impact on the ability to obtain, maintain, or afford health insurance, disability insurance, and life insurance. Future health problems experienced by living donors following donation may not be covered by the recipient's insurance.
In addition to the previously mentioned medical and surgical risks associated with kidney donation, there are risks specific to each transplant center. The Scientific Registry of Transplant Recipients, or SRTR, publishes data every 6 months showing the survival of the donor graft, or the transplanted kidney which is now in the recipient, and recipient survival at 1 month and 1 year after transplant. When you come to Mass General for your initial evaluation, you will receive the most recent SRTR data for Mass General, as well as an expected survival and nationwide survival as comparison. If during your evaluation new SRTR data is released, you will receive the updated numbers. If you donate through the paired exchange, you will also receive the SRTR data for the transplant center where your kidney will be transplanted. Medicare also evaluates the SRTR data to make sure we are complying with their requirements and bases their approval of transplant centers on these statistics. Next, we will discuss your rights as a potential donor. Your healthcare information will be protected, and we will do everything we can to make sure the recipient will only know a limited amount of information about your evaluation. You may opt out of the donation process at any time, and the Independent Living Donor Advocate can assist you with this process. If you are rejected as a donor at Mass General, you can reach out to another transplant center which may have different selection criteria for living donors and see if you could be evaluated there. Based on our most recent SRTR data, Mass General is a Medicare-approved transplant center. If we were to lose our approval, the recipient's immunosuppression medication would likely become much more expensive, as Medicare covers most of those costs. As for your responsibilities, we ask that you provide complete and accurate healthcare information. Also, we need you to know that it is a federal crime to knowingly acquire, obtain, or transfer any human organ for valuable consideration. It is also very important that you follow up with the transplant team at 10 days, 6 months, 1 year, and 2 years after donation. Again, these follow-up appointments help us make sure you are doing well with one kidney and are also required by UNOS. We have provided you with a list of resources related to living donation. First is the website and patient services line for UNOS. Next is the website for New England Donor Services, which is the organization responsible for allocating deceased donor organs in the region. Next is the website for the National Kidney Foundation. Their site has information about living donation for both potential recipients and potential living donors. The section labeled The Big Give has information for donors. Next is the website for SRTR. You can visit this website and see the SRTR data for any transplant center in the United States, as well as compare the number of transplants done at each center. The Transplant Center at Mass General also has a website. You can get to the living kidney donor information through the kidney transplant page. Finally, we have a link to the National Living Donor Assistance Center, which can help donors with transportation and accommodation costs, especially if they are coming from a great distance.